Hello, everyone, and welcome to the May 2025 UCLA Tarjan Center Distinguished Lecture Series. I'm Dr. Jasper Estebio, Director of Training for the Tarjan Center, and it is my pleasure to be here with you today. As we welcome you to our lecture series, we would like to extend a thank you and acknowledge our co-sponsors, the UC Lend program, the UCLA Center for Autism Research and Treatment, and the UCLA Intellectual and Developmental Disabilities Research Center. A couple reminders before we get started. Please do enter your questions for our speakers into the Q&A throughout the talk, and we'll facilitate discussion at the end of the presentation. We also invite you to complete our evaluation survey to provide feedback and suggestions for future lectures. The link to the evaluation survey will be sent in the chat today, as well as in a follow-up email later this week. All right, I now would like to introduce our speakers. Let me see if I can get them on the screen. Hello, good morning. Our first introduction, I have Dr. Christine Moody, who leads the post-secondary education and employment initiatives at the UCLA Tarjan Center, including multiple partnerships with the California Community College Chancellor's Office and the California Department of Rehabilitation toward better serving young adults with developmental disabilities in those systems. Most relevant to today's talk, Dr. Moody has also led the data analysis on the 2023 Self-Determination Program evaluation on behalf of the UCLA Tarjan Center and evaluation partners. Beyond her work at the Tarjan Center, she is the Director of Research at the UCLA Peers Clinic, facilitating research efforts on the advocacy and implementation of the various peer social skills programs. By training, Dr. Moody is a licensed clinical psychologist and has been working with youth and young adults with neurodevelopmental disorders and their families for over 15 years. In addition, we also have Christine Tolbert, who is the statewide self-determination or SDP program manager at the California State Council on Developmental Disabilities or SCDD, where she leads California's statewide SDP orientation efforts through the long-term interagency agreement with the Department of Developmental Services. With over 20 years of experience in California's developmental disability system, Christine brings a wealth of knowledge in systems change, cross-sector collaboration, and policy implementation grounded in equity. Her earlier roles, including managing a forensic caseload at a regional center, serving as a client's rights advocate at Lanterman Developmental Center, and leading advocacy initiatives in SCDD's Orange County office, have shaped her statewide systems perspectives. She has also led the Orange County Healthcare Task Force and continues to support other collaborative efforts focused on removing systemic barriers in healthcare, education, employment, and service access. Please join me in giving a very warm virtual welcome to Dr. Christine Moody and Christine Tolbert. Thank you both.
Thank you so much for that warm welcome. Excuse me. I'm thrilled to be with you all today. And just a special thank you for taking your time and your interest in the SDP evaluation and the program itself. So in the first part of today's session, we will walk you through a high-level overview of the self-determination program and review key findings and recommendations from the program evaluation and report. In the second part of today, we will share where to find additional information about self-determination program, including how to access SDP orientations, and we will guide you through some key websites so you leave today knowing exactly where you can go next. All right, so before we jump in, want to acknowledge the large team that has contributed to this program evaluation and our presentation today. And this was really across the whole state of California and our federal partners. So Christine Moody and myself are there at the top. And then, of course, we have Erin Carruthers, the Executive Director for the State Council, Elizabeth Lageson, the Director for Tarjan Center. We have Vivian Hahn from Disability Rights California, Keisha Weller from the Tarjan Center, Yasmin Valerian from the Tarjan Center. We have Sabrina Epstein from Disability Rights California, Will Liner from Disability Rights California, Nurit Benri from the Tarjan Center, Beth Stoffmacher, Beth, from the Tarjan Center, Larry Yin from USC, Aubryn Stammer from UC Davis, and Andy Impardo from DRC. And again, I want to make sure that I'm mentioning all the names because it was a full, as you can see, a full all hands on deck. So next slide, please. With our welcome and overview, we're going to set the stage for today. So just a brief history of the self-determination program in California. Many of you may not realize this, but there has been a pilot in the state since 1998. It was launched in 5 regional centers, and the pilot itself showed really promising outcomes for higher satisfaction, more inclusion in their local communities, and then stronger autonomy. In 2013, California passed Senate Bill 468, which created our current version of the self-determination program into statute. After several years of a phased rollout, the self-determination became eligible in its current form to all eligible regional center consumers in July of 2021. So we're still pretty new when you look at systems change. What is the self-determination program? I could honestly wax poetic about that for quite some time. It is a passion, but really the big high-level summary of California's self-determination program is a way for people with developmental disabilities and their families to have more choice and control over the services and supports they receive through the regional center system. Instead of relying on solely vendored or contracted service providers through the regional center, the self-determination program allows participants to create a custom spending plan to align service needs with their IPP goals. This means that folks can choose their own service providers, including those who are not vendored, and they can decide how, when, and where services are delivered. It's important to be clear, though, the self-determination program does have guardrails. The services and supports in this program must meet federal requirements to qualify for something we call federal financial participation. That is the federal share of funding that makes the program possible here in California. We will discuss this and use of generic services first in the orientations. Next slide. So the 5 principles of self-determination are built on, these 5 principles are what self-determination in California is built on. These are actually national principles, but we'll talk about what that means here. So freedom is the right to make choices about your life, where you live, who you spend time with, how you spend your day, and what your goals are. In self-determination, this means that you're limited not only to services on a list with certain service providers, but that you have the freedom to design a life that reflects your values, your cultures, and your dreams. An example, a person might choose to take art classes from a local community center instead of an existing day program, or hire a neighbor to support them at home. The authority piece is having a control over your budget, deciding how your annual budget is used on needed services and supports. Participants, with help from their team if needed, decide what services to purchase and from whom. An example of that would be maybe instead of using a regional center, or instead of the regional center choosing an existing provider, the participant might hire a personal support worker directly or choose from an unvendored service that better fits their needs. The support piece is big in this program. This means getting help to be able to make informed choices and follow through with your plan. It doesn't mean being left to do everything alone. This includes support from family, friends, and others you trust to help you explore options and organize services. An example of this might be someone might need help comparing service providers, writing their spending plan, or understanding how a service works. The responsibility piece in self-determination is big. This means taking ownership of your plan and budget, using public dollars wisely, and making sure that services meet your IPP goals. It also means being accountable to the rules, such as making sure services are eligible for funding and that time is documented correctly. An example of this is participants must make sure that their team submits invoices and timesheets correctly and on time. And then the confirmation piece. This is really you, the person with the disability, are the one leading decisions and services about your life. Your voice should be the most important one in your individual program plan and spending decisions. Even if others are helping you, the decision should reflect your choices and what you want, not necessarily what others think is best for you. Next slide. Thank you. So why this report? The report we're discussing today was required by the Self-Determination Program statute that can be found in the Welfare and Institutions Code section 4685.8. In June 2023, a public report must be issued to assess how the self-determination program is living up to those 5 guiding principles and recommend any ways to improve its effectiveness here in California. This report, as I mentioned earlier, is a result of a partnership between the State Council on Developmental Disabilities and the University Centers for Excellence in Developmental Disabilities at the UCLA Tarjan Center, USC CHLA, and UC Davis. It also included, of course, our other federal partner, as mentioned, the Disability Rights California. Next, we're going to hear from Keisha Weller, the Senior Advocacy and Community Liaison at UCLA Tarjan Center. She represents the Tarjan Center at local, state, and national meetings, including as a liaison to the Self-Advocacy Statewide Network. And she was currently serving on the master plan for Developmental Services Stakeholder Committee. Keisha is a longtime client of the California's regional centers. She's going to share about her experience trying to access the self-determination program. She prepared this video for a different conference last year, but her experience is salient to today's session. And then after Keisha's video, my co-presenter, Christine Moody, will walk us through how the evaluation was conducted and what the findings tell us.
Hello, my name is Keisha Weller. I am the Senior Advocate and Community Liaison at the UCLA Tarjan Center UCED. I was also a co-facilitator for the UC Leadership Academy. I am an ECHO team member for the UC Davis Mind Institute UCED. I am so sorry I couldn't attend the AUCD conference this year, but I appreciate the opportunity to share my experiences with the Self-Determination Program, or SDP for short, on this panel. I have received services through the California Regional Center system since the early 1990s. When the SDP became available to all regional centers, my case managers didn't tell me anything about it. I was frustrated that I knew that the SDP from other resources, but I wasn't being told by my case manager. I was upset that the regional center had assumed I wanted to keep my traditional services instead of choosing the services that work for me and meet my needs. With the traditional services, the regional centers are the payer of last resort, meaning I must get generic services. These services are funded by other agencies. With the SDP, I will be able to plan my own budget to meet my needs. For example, a couple of years ago, I wanted to receive job coaching services, and I had to wait for months for the regional center. With SDP, I can hire my own job coach without waiting. The SDP should be fully accessible and streamlined, but there are barriers to accessing the program. I first applied through the SDP in August of 2022. I was finally accepted in February of 2024, but I still didn't receive any services. It had been 9 months and I still hadn't received the funds to pay for the services I chose. I am lucky enough to be aware of SDP, but others receiving resource center services may not understand the system without it being explained. My previous service coordinator knew a lot about SDP. One day when I tried to call him about the program, I was told that he quit his job at the regional center. To my knowledge, nobody on his caseload was told that he quit. It was a few months before I was assigned a new service coordinator. The new service coordinator was not familiar with SDP, so I was beginning from nothing. I knew more about the SDP than my service coordinator did. Although there has been a lot of negative experiences with SDP when I participated in the SDP evaluation focus group with the Tarjan Center, I finally felt that my voice and my concerns were being heard. The questions and discussions help participants reflect on their own experiences with SDP. We had the chance to share the good, bad, and the ugly of SDP. On February 23rd, I had contacted my regional center's client service director, asking her to expedite my entry to SDP by November 1st. I was successful in finally getting into SDP after years of waiting. I hope that more and more people can voice their own experiences with SDP so that the program can be more refined and accessible. Everyone has a right to the 5 principles of SDP. They are freedom, authority, support, responsibility, and confirmation. Thank you so much for listening and have a great AUCD conference.
All right. So as you can hear from that video, Keisha there is sharing her own experience, and many of the themes that she shared are echoed in our overall findings from the report. So today, before I jump into the program evaluation, we want to just echo that we hope that you'll walk away from our presentation with understanding how we got the information from the community for this evaluation, what we found, and also how that data and the report is being used to drive change. So let's dive in. So first, we're going to share a little bit about our methods and how we engage the community. So first, we really thought it would be important to both do a survey that would allow us to get numbers, but also do focus groups where we actually talk to people about their experience, and you heard Keisha mention that, and really get to hear more detail and context to understand more. We wanted to prioritize diversity in voices, particularly ensuring that people with developmental disabilities themselves were heard whenever possible, as well as their caregivers. And we also wanted diversity in terms of people enrolled and not enrolled in the self-determination program. We thought this was important to understand why people had not enrolled. Were they happy with their current, traditional services? Or was it that they hadn't heard about it yet? Or they thought the self-determination program might be too complicated? Those, pieces are relevant to the experiences, or related to the experiences that people and consumers are having with the program and how the program is being shared, how it's working. So our surveys and focus groups had incentives to participate, with surveys leading to a lottery to win one of $25 Amazon gift cards. And the focus groups, everyone received a gift card for $50. We thought that this was really important in showing people that we value their time and their perspective. It also helps get wider participation. And we were able to work collaboratively with Department of Developmental Services, or DDS, and the Office of State Publishing to obtain a mailing list in which we sent out flyers with QR codes to participate. We also distributed the different phases of the study through the networks of federal partners working on this project. And we're lucky enough to have strong partnerships with several community organizations who also shared with their audiences. So we were really mindful in particular about the focus groups and enabling participation and accessibility. We had these events on Zoom to be able to reach the entire state. We had live Spanish translation to allow us to reach monolingual Spanish speakers. And our questions were carefully designed to be non-leading and balanced. For example, we started out neutral, asking about their experiences with the program. Then we asked about obstacles, but also about what was helpful. And when asking for their suggestions about the self-determination program, we asked what they would change, but also what they would keep. So again, balancing those questions. All questions were reviewed by people with developmental disabilities, working within our federal partner organizations as well, before being used to ensure accessibility in plain language. We plan to have 9 focus groups with about 10 to 12 people in each, and wanted to capture these different perspectives that I talked about earlier in terms of people with disabilities, their families, those enrolled, those not enrolled in the program. And so we have these groups here, these 5 bullet points. We also had a focus group with independent facilitators, in which in California's program, independent facilitators help guide families and support their decision-making and person-centered planning process. They really have a unique perspective, as they often have had experience with multiple families trying to navigate self-determination program, and sometimes have experience across different regional centers too. So they were able to speak to a little bit of the bigger picture. So we sent out an interest form related to interest in participating in these focus groups to collect demographic information so that we could really funnel and choose participants based not only on these 5 groups that they identified with, and of course their availability for our focus group time slots, but also their demographic identities. And I'll be talking about that on our next slide. Before I get there though, we were so shocked and pleasantly surprised by the response and the interest in participating in our focus groups. We had over 1,500 people sign up. And we only had capacity for those 9 live focus groups with about 100 people total across the all 9 focus groups. But we hated to not give all those other people an opportunity to share their voice. So after the focus groups, we put the focus group questions into a written survey and sent that survey out to all that had signed up or expressed interest in being part of the focus groups. And we were able to code that data as well for themes, just like we did with the focus groups themselves. We had the survey translated into over 10 languages, again, to increase access for a diverse audience or diverse participants. All right, so as I said, we wanted to try to have as representative of a sample as possible. And unfortunately, sometimes with a survey, you don't have a lot of control over that. You can share it out with, particular communities. You can, do your best to spread it far and wide, but it's hard to predict who will respond. In this circumstance where we had this long interest list, we actually had the ability to be really intentional about our sample for the focus groups. So we used the Department of Developmental Services, DDS, published data on regional center consumers and their demographics, and we worked to mirror those in our focus groups. So we considered distribution of race, age, diagnosis, gender, language, and county. And it was a huge process that really boiled down to kind of this balanced picking of people to ensure we had the best representation from the communities that regional centers serve. So all that to say, I want to share how this all played out, and we're actually quite proud of the engagement and diversity that we captured. So as I described, we conducted our program evaluation in different phases. So first phase was this survey where participants rated their agreement to certain statements on Likert scales or were given options to choose from. This was our survey to get numbers. We called this the quantitative survey, and we had 242 participants in that. Phase 2, we had our focus groups with about 100 people to hear about the lived experience of stakeholders, which then grew into phase 3 to allow people to respond to those open-ended questions from the focus group in written format. And that had 265 responses. So in total, we had 604 contacts with stakeholders, most of whom were enrolled in SDP, and we had a good representation of both caregivers and regional center consumers speaking for themselves. Here is our breakdown by diagnosis and age across the full sample of 604. As you can see, we had the highest representation of autistic participants and their family members with intellectual disability second. For age, our largest group was young adults, followed by minors, which were mostly represented by family members. And these numbers overall pretty closely mirror the DDS data on SDP enrollment that were released at the time of the program evaluation in February 2023, which we were happy with. Here are the participants broken down by race and ethnicity. So we had a diverse sample, about 40% white, 20% Hispanic or Latino, 20% Black, 10% Asian or Asian American, and then 15% or so that fell in this other ethno-racial identity group, which included multiracial participants as well as participants who identified as Middle Eastern, American Indian, Native Hawaiian, or Pacific Islander. We were really happy to see all regional centers represented in our data, with South Central and Lanterman and Alta being the most prevalent in representation. South Central and Lanterman are focused in the Los Angeles area, which makes sense as a populous city, and Alta covers Sacramento, another big city. All right, so moving in to share some of the findings and takeaways from the program evaluation. I'm going to be keeping this high level and combining themes that we saw across different phases of the program evaluation. So because of that, I've noted on the slide where we saw evidence of that finding, which phase. So you'll see P1, P2, P3. So P1 is that quantitative survey, P2, focus groups, P3, qualitative survey, the open-ended survey. All right, so first we found wide support for the concept and the idea of the self-determination program. Individuals and families were so excited and hopeful about the idea of having more freedom in designing their programs and choosing their providers to be able to pursue their individualized goals. And we also found evidence that the self-determination program did further those principles of self-determination. Participants regularly reported enjoying that freedom of being able to choose their providers, use different types of services that maybe were not available to them in the traditional system. Participants in the self-determination program were significantly more likely than participants in traditional services to report having supports to help them with their services and budget. And they were also more likely to feel that their services allowed them to live a good life, which in the end is most important. Many connected self-determination to positive growth and progress in areas like self-awareness, responsibility, mental health, community integration, independence, employment, quality of life. And following from these takeaways, we really also found that in general, participants were satisfied with the program. Quantitatively, a majority of respondents reported being satisfied and that they would recommend it. And in qualitative data from focus groups and open-ended survey responses, we also saw satisfaction as a frequent theme, with several participants going so far as to describe the SDP program as life-changing. So I have some quotes on the next few slides really to kind of illustrate some of these big takeaways. So this is a current SDP participant and regional center consumer. They're saying, with self-determination, I have more freedom to choose who helps me get things done. My staff is now someone I trust and not a stranger. I love that I have a spending plan that I can see and understand. This is a family member who's saying SDP has been life-altering. My son makes all of the decision in his life now. He receives social support in a natural environment, doing the things he loves. He has support taking a college course at the local junior college. He's working with supported employment and had a paid internship at his favorite comic book store. He travels independently to hang out with friends. And another current participant, my services in SDP better meet my needs than the vendors through the traditional model. SDP has improved my quality of life. I'm receiving the in-home and community support I need. So despite all of those positives, there were some pervasive indicators that participants wished the program was less complex, less time-consuming, easier to navigate. The most common theme in the focus groups and qualitative survey represented feelings of administrative burden, and of having a lot of paperwork, a lot of steps on clients and families. They also expressed other barriers related to lack of support, including difficulties accessing information about the program, which we heard from Keisha earlier. Service coordinators not being well versed in the program, also part of Keisha's experience, and staff capacity negatively impacting their experience. Service coordinator turnover, wait lists for the financial management systems that process payment for the self-determination program services, as well as poor customer service from those financial management programs sometimes, as well as lack of availability of independent facilitators to support them. It's also so important to note that with this increased freedom, there's also the increased responsibilities. So it's so important that consumers have information, training related to navigating that responsibility. For example, hiring someone and knowing what the appropriate labor laws are and really being able to submit timesheets like Christine was mentioning earlier. So this is a quote that really highlights a few things, highlights those long waits and getting started with the program, also highlights the dilemma there in moving to that self-directed service system. That participants have more to do when they're finding and choosing these services and coordinating those services, and that they're all found in different places, and it can be overwhelming. So choice and flexibility is so important and critical, but also seems to have a cost, at least with how we have it set up now. And we've had many people and family members saying similar things as this quote, wishing that there was a directory or an easier way to find the services that they needed and wanted. And I know there's been some movement in that light too. Here's another quote. Parents are already overwhelmed. It is a lot to deal with, all the steps to get the services, to chase down the paperwork, spending plans, signatures, and people. Simplify this process even more, some way, somehow. All right, so the last big takeaway from our evaluation is that there seem to be some inequities in the program. Focus group and qualitative survey participants report on several different forms of inequities, including racial disparities and how the program is being implemented across regional centers as well. For example, differences in what is being approved by different regional centers, differences in the size of the budgets across different regional centers. And participants also shared that due to that high level of complexity and administrative burden, the program was not readily accessible to individuals with developmental disabilities who don't have as strong of a support network, for participants for whom English is not their first language, as well as for families with varying socioeconomic and educational backgrounds. And we did find some statistical differences for specific demographic groups. So data suggests that for BIPOC or Black, Indigenous, and people of color, they were less likely to report meeting with their service coordinator and were less likely to describe receiving support from regional center while in the self-determination program. BIPOC participants also reported significantly lower levels of satisfaction with the program. However, one interesting finding is that on the qualitative survey, they were more likely to describe achieving successful outcomes through the program. And then our these last two bullets here, we also found evidence that the self-determination program might be harder to navigate for younger participants and for autistic participants. So both of these groups were more likely to endorse different types of challenges and barriers. And these higher rates of challenges may help explain the finding that respondents who were associated with participants under 21 were less likely to recommend the program to others, and autistic participants were slightly less likely to narrate being satisfied with the program. So here's a quote that illustrates this idea. So I'm a highly educated professional with a master's, able to reduce my work hours so I can keep the self-determination program going, and I am having a very hard time. How is this ever going to be accessible for non-native English speakers, those who can't afford to work less, those who may not have much support? So here are some figures that get into the findings above. So on the quantitative survey regarding the statement about satisfaction with their experience within the program, the majority of participants, about 70%, expressed some level of positive agreement. And among current participants in the program, the majority, a higher number, about 77%, expressed some level of positive agreement when asked if they would recommend the program. So it's interesting, there is a small group there that is not that satisfied, but would still recommend it. So it's, maybe for them, it's challenging, still difficult, but they would recommend it over the traditional services. All right. So these, this graphic here is from the focus groups, and these were the most frequently coded themes of helpful aspects and positive benefits from the self-determination program. I know it's quite a small font, so I'm mainly going to focus on the top three themes here. So the most common overall was the support for the principles and idea of the self-determination program, followed by people sharing how they experienced or saw the program as providing increased freedom, authority to choose services and supports. And the third most common theme was overall satisfaction with the program. Some other examples of themes, so stakeholders often found sources of information outside of regional center helpful. That includes, talking to other families, social media, advocacy organizations. With respect to services, we saw that participants reported that SDP allowed them better service access, as well as more tailored or individualized services and the ability to pay their providers better rates. And they really appreciated when regional center, FMS, and independent facilitator staff were helpful. All right, so this is the themes that are relevant to barriers and challenges. And as we discussed before, the most common theme here was administrative burden, with about 20% of the coded thematic barriers falling in that category. We also saw a lack of information about the program, inequities, challenges with staff capacity and staff training coming up as top themes in the focus group. Participants also identified specific flaws within the SDP system, such as FMS policies limiting the ability to pay for services in advance, and the lack of timelines within the enrollment process to create accountability and really streamline that enrollment. People were frustrated when regional center denied services or budget items, feeling like their freedom and authority was limited. And many experienced significant delays in enrollment or in payments being processed. And though it was less common, some felt resistance towards the self-determination program within the regional center. For example, service coordinators either implicitly or explicitly discouraging their enrollment. All right, so I'm going to end here with a quote that I think sums up all of our findings and inspired our title for today's talk. It holds so much promise. I believe SDP is the best path forward for the IDD community, but we have many potholes to fill and bumps to navigate. All right, so now I'm going to pass it to Christine to talk about how this program evaluation data is being used to make progress.
Great, thank you so much. Okay, let's move to the key audiences. So I mentioned this a little bit earlier, but our key audiences for this report were the California State Legislature. The State Council submitted the SDP evaluation report to the legislature on June 30th, 2023, and then shared it with DDS and our federal partners. And those federal partners, again, as a reminder, are the UCLA Tarjan Center and Disability Rights California. Together, we engaged advocacy groups across the state to review the findings and explore solutions. This process really confirmed broad stakeholder commitment. People want this program to succeed and stay in California, and they're ready to work toward that goal if the system supports them. Next slide. So before we move into the recommendations, please know this report with many different options is available on the State Council on Developmental Disabilities website. The full report is the one submitted to the legislature and is 77 pages in English. There is also an executive summary that is 11 pages. That is available in English, Spanish, Chinese, and Vietnamese. Another report option on our website is the plain language executive summary. That's 13 pages and gives you a great and easy to understand summary of the original full report. The report was also mentioned in an LA Times article featured on April 15th, 2024. The article was focused on the underrepresentation of Latinos in the self-determination program, the difficulties of getting into the program itself, and some of the possible solutions recommended by advocacy organizations. These comments referenced in the article confirm the findings of this report. Next slide. So the recommendations. This report and community input confirmed several key challenges. Access to information is inconsistent and often unclear. Enrollment and budgeting processes vary too much by region. Participants face a high administrative burden. Independent facilitator pay and availability is limited, and then underserved communities are left out or stuck. So the recommendations included improving access to information about self-determination program. So this requires, in terms of recommendations, regional centers to share information about self-determination to people new to the regional center system and offer the choice of self-determination as part of the IPP planning process. This would enhance outreach and awareness of self-determination among informal networks, improving the capacity for peer-to-peer counseling about self-determination, and developing clear and accessible guidance materials. This is happening with the updated IPP templates that are now in use, and it's affirmed through the master plan. Streamlining the enrollment process by minimizing steps that aren't statutorily required, developing clear timelines and deadlines to ensure that participants can effectively progress through the enrollment process, strengthening the oversight and role of DDS to ensure consistent application of rules and procedures across all regional centers, and to promote equity and fairness, and increasing the rates of the financial management service providers. That did occur after this report was issued. Streamlining the budget process. This was recommended to standardize the approach on how individualized budget amounts are determined to prevent discrepancies and remove subjective judgment of regional center staff. Reducing administrative burden among SDP participants by shifting obligations that are currently placed on individual participants, independent facilitators and or service coordinators, and placing the obligation instead on system-wide functions such as establishing clear guidance regarding spending plan expenditures, establishing a publicly available service provider directory, as Christine mentioned a little bit earlier, expanding the affordability and accessibility of independent facilitators, enabling SDP Ombudsperson's office to provide more dedicated problem-solving support. Some of these issues have been addressed via directives and initiatives, such as the provider directory and updated payment options for folks to get help from trained helpers during the enrollment period. Improving compensation and capacity of independent facilitators. This recommendation was for modifying the self-determination statute to allow independent facilitators' pay to be allocated as a specific line item when forming the budget. investing in building independent facilitator capacity with a particular focus on recruiting independent facilitators from underrepresented communities, including BIPOC and individuals proficient in languages other than English, and ensuring consistency and quality of independent facilitators across regional centers by establishing core competencies. There are certain implementation funding has addressed pieces of this recommendation to date. Ongoing discussion is occurring and certification standards for the independent facilitators are pending. One of the other recommendations is to leverage self-determination as a model to improve workforce development, hiring, and retention. This was by using hiring and rate setting flexibilities found in self-determination to gather data on, to try out pilot projects related to new or innovative service types or service code bundles that may be more effective at increasing the number of providers available to serve traditionally underserved groups. We are seeing this. It's not specific to a pilot project, but this is beginning to occur. And then creating a more equitable system and mitigate disparities. This would occur in our recommendations by tailoring supports to underserved communities through targeted outreach campaigns to raise awareness about the program within historically underserved and unserved communities, by expanding the pool of providers who can meet the unique cultural and linguistic needs of these communities, and by implementing measures to ensure equitable distribution of resources and services, such as increased funding or incentives for providers serving historically underserved areas, and identifying how DDS and regional centers can build capacity to support underserved communities in the self-determination program. Next slide. A DDS directive is an official instruction or rule given by the Department of Developmental Services to help make sure that programs are working right. So in this case, DDS directives explain how specific parts of the self-determination program should be carried out. Directives help the regional centers, providers, and participants, consumers know the clear rules. The directives are meant to make it clearer and easier for people to use and understand the details about how the program is run. Since this report was published, DDS has issued 25 new directives on the self-determination program alone. So there have been lots of changes and updates in an almost 2-year period, and there are more to come, I'm sure. On your side, some of the key topics, such as clarifying the billing requirements and other concerns related to the financial management service providers. DDS has also contracted with 2 entities to construct both financial management service and independent facilitator certification training and standards. This is to support the capacity across providers of both types of services. That is also currently pending. There has been guidance on goods and services that people can get through the self-determination program. Sometimes there's confusion and differences on what things can be bought. These directives they help with that. Since we heard from many people about frustrations in the enrollment process, DDS has clarified the way this happens. So people can get paid trained supporters of their choice to help them get from that orientation as the first step all the way to their self-determination program start date. A few of the directives clarify that there were some changes in the enrollment and transition process, including how people can get those paid trained supporters to help. You can see all the DDS directives on their website, and we will be showing that to you very shortly. So there was some proposed legislative action following this report. It was SB, which stands for Senate Bill 1281. This was introduced by Senator Menjivar on February 15th, 2024. The goal of this bill was to make SDP easier to access and fairer for everyone. As this report confirms, self-determination has had some complex requirements, which makes it hard for everyone to participate equally. The bill wanted to streamline the processes, such as standardized and simpler steps in parts of the enrollment process. Examples of that were like setting personal budgets, the financial management service costs and fees, and then developing a spending plan. Supporting participant choice was ensuring that people can choose their service providers freely. Those transition support pieces were to make sure participants had help from trained and reliable people when they're trying to get into the program. And then improving those financial management services. This was to clarify costs on what financial management service providers could charge participants, ensuring that they pay service providers on time, and then reporting on the financial management service provider performance. This bill was vetoed by the governor, instructing stakeholders to take these concerns to the DDS master plan and include it there, which takes us to our next slide. So the California DD Master Plan outlines a 10-year roadmap to build a more equitable, person-centered, and coordinated system of services and supports for individuals with developmental disabilities across their lifespan. There are many overarching themes within the master plan, which can apply to self-determination as well as apply to the other models too, such as the traditional, and part of the traditional is the participant-directed services, as well as self-determination. These points were explicitly on your slide related to the self-determination section of the master plan. So we have, including but not limited to, improving access to information and clarifying the roles, streamlining enrollment, reducing administrative burden. Part of that might be to simplify spending plans. The financial management service provider enhancements, which includes accountability, labor laws, and timely payments. Promoting equity and inclusion, increasing the diversity of participants in the program. Enhancing the orientations, and then ensuring person-centeredness. I threw that one in there. That certainly applies to all programs. Moving forward, continued advocacy, right? Continuing advocacy and reducing complex processes for participants and families, streamlining the processes across the state, updating the orientations to ensure that the materials follow the current updates. Spoiler alert, we're working on that. The data needs are really the determining the outcomes, getting those outcomes of folks in self-determination compared to the people in traditional services. Looking at improving data collection and comparison in general. DDS is actually working now on collecting more information, more detailed information on those in self-determination to help with this. And then looking at differences and barriers by demographic group, including differences for BIPOC, younger, and for those with autism. Some future research considerations that came from this are gathering perspectives of regional center service coordinators. We did not collect this data in this report, but it would be helpful to know what their experience, training, and other factors look like to support the self-determination. And then finally, how other certain systemic issues are affecting and impacting the experiences for those in self-determination. Thank you for your time today and for allowing us to share the progress made and some of those future needs for self-determination. At this time, I'm going to turn it over to, I believe, Dr. Jasper.
Yeah, I think we're actually gonna stick with you, Christine, and have you go into the resources.
Oh, thank you so much. Okay. Give me just a moment here. Thank you for that reminder. I will pull it up.
While
So
Christine is pulling that up, feel free to put your questions in the
there we
chat.
go.
We're going to quickly go over some resources related to self-determination, and then we'll do Q&A at the very end.
Yes,
Awesome. Thank you,
to both.
Christine.
Thank you so much. Reminder to our audience, please continue submitting those questions. And then as Christine Tolbert goes over the resources, and we'll facilitate Q&A in just a couple minutes.
Okay, great. So on your screen, you should be seeing the Department of Developmental Services main page website. Thank you, Christine, for confirming that. And folks, just so you know, these resources will be posted alongside this PowerPoint. So it will also live on the Tarjan Center website. But this is where you can go right after today to start learning a little bit more about the program. If you click on the Self-Determination Program button, this will open up all things self-determination for you. Okay, so this gives the history, and each of these you can click on to find out more information. That program directives piece, that's where those 25 incoming directives live. And actually, I'll just show you that really quickly so you can see that they are organized by date. So that's helpful. Frequently asked questions is a really great place to go. How you can find the ombudsperson to get help with any questions or maybe fact-checking information. So again, this is their main website with all things self-determination. I also want to show you our state council orientations website. This is where you can go to find our calendar of when the orientations are happening and in which languages. We also have handouts here. So I like to tell folks that the information that we share in the self-determination program orientations, this is your first step in determining, is self-determination right for you, and getting that initial, piece of fact so that you can make that informed decision. The materials that we cover are publicly posted on our website, and they're highlighted there under orientation handouts. These are in English. We also have them posted in many other languages: Chinese, Tagalog, Korean, Hmong, Armenian, Farsi, and Arabic. And then we also have our individual websites with Spanish, and the materials are posted in Spanish, as well as, I'm clicking quickly here, folks, I know, and Vietnamese. So again, those orientation materials, if you're interested in an orientation, that would be your first step before enrollment, is right here on our webpage. And the handouts and everything that we discuss in those orientations are on our webpage for your own research. After you get all of this information, we know it's a lot. We like to let folks know that there are a lot of places they can go to start to connect to their self-determination communities in their area, to start to meet the dedicated staff at their regional centers who are helping with self-determination, to meet folks that are enrolled and involved in the program in their local areas, as well as to start to meet and greet and get those warm connections with those person-centered planners, independent facilitators, and other folks who are supporting those interested in self-determination. One of the best places that you can start to do that after today is to connect with your regional centers, local self-determination advisory committees. It should be on your screen. This link will be in that resource guide that we'll be sharing with you after today. And it does let you know where they are available. Each of these links will take you to your regional center's dedicated self-determination page so that you can find out who's in charge, when those meetings are, and you can find a way to maybe attend. I believe that all of them still offer some version of a remote or dial-in option so that you can be present and start to dip your toe in, if you'd like to, in learning more about self-determination. Again, those are from our website, and it is listed here. Okay, I am going to stop sharing.
Great.
And
Thank
I
you so
believe we
much.
can open it up for questions.
Wonderful. Thank you again to Dr. Christine Moody and for Christine Tolbert from the State Council on Developmental Disabilities for being here and for presenting this information. Thank you for this very thorough overview on SDP. I know our audience certainly has lots of questions, and we've been getting so much feedback in the last couple months on requests for this topic. So we very much appreciate you being here and showing us how through the work of all of our partnerships, we're enacting what's actually required through the DD Act to involve individuals with developmental disabilities and their families in the shaping of policies that impact them, like self-determination. So really wonderful to show us how we're truly living up to nothing about us without us in the world of developmental disabilities. I'm going to take a look at some of the questions, and I'm going to start us off with maybe some of your two reflections on doing this project, any lessons learned from the two of you that you wanted to share to our audience and our community.
Yeah, I think really hearing from different stakeholders, I think, is really important. And we were struck by a lot of the similarities in themes, but I will also say that, having for example, the independent facilitators as a perspective in our program evaluation was really did add some important information that we wouldn't have gotten, I think, otherwise. And so, that led us to one of our recommendations that Christine Tolbert mentioned around, including other voices, for example, the regional center service coordinators, and their perspectives on the program and their experience with, helping individuals move through the program. So I think the inclusion of, different stakeholders who are involved and is really, really important. I don't know, Christine, if you have other reflections you want to share.
I appreciate the question, actually. And I do echo Christine's comment about a lot of those similarities.
Yeah.
All of us involved in the system, including all the advocates and advocacy organizations that were part of our collaborative, rollout and really helping to share this information statewide when it was first released. We're all seeing the same things. And I think that that's affirming too, right? Because you're all noting the larger systems needs. And when you're kind of all agreeing on that, I think the collaborative efforts and then DDS issuing the directives in response is how you turn a big ship, right? State programs they're large, and this is still newish. And so having that collaborative, having a lot of that similarity and agreement on the big things that need to change, I think has that lasting and larger change. I think one of the other pieces that was really good on this was the fact that since this type of program is not new in our country, but California is so large and so diverse that we're learning how to do this within a federal structure that has to be so unique for the state. And just appreciating, I think, all the pain points coming in from the different the different stakeholders, as well as being met with, I think, a very collaborative approach, right? And collaborative doesn't have to mean everybody always agrees, but collaborative in the sense that we all want this to work. And I think when you find that common ground, being able to move forward with, again, that lasting systems policy change affects and benefits everyone, right? Whether it's the participants and their families and or those service providers and other advocacy organizations supporting folks. So those would be some of my initial feedback.
Right. Thank you both so much. I think that, again, ties back to the title of your talk. It holds so much promise. And also, there are lots of things that we want to work on to improve the program, to continue to address these barriers, and to roll out such a large scale program so that way it does speak to the needs of all of the individuals who are impacted. I'm seeing here that maybe we can ask more about addressing certain groups. So I think I was really struck by, of course, addressing the inequalities across different demographic groups, and trying to make the process less complex and less time consuming. Can you both speak to maybe some of the priorities if we were to triage some of these issues and roll them out in a more systematic way so that way we are addressing things as needed? What are the kinds of top three of those barriers maybe that are hoping to be addressed as we continue to refine?
Christine, I'm happy to pitch hit on this one. So there have been, and this isn't necessarily new, right? But it maybe has been affirmed with some of the goals. So the Department of Developmental Services has provided what we call implementation funding to each regional center. And the regional centers are working in collaboration with those local advisory committees, that screen that I shared, so that folks can find where their local advisory committee is, when and where they're meeting. That local advisory committee is tasked with determining the best way to essentially put those funds into their local community to help with this very need, right? Outreaching to the local geographic region, which certainly includes those underrepresented communities. And they are all doing that in true fashion in our state differently, right? So I can't give a targeted answer to that because each regional center has its unique region and unique needs. And the regional center, in collaboration with that advisory committee, is working to determine what is the best use of these funds to be able to improve access for those in our area that we know are having trouble. Not just that, but at what point in their self-determination journey do they need that additional support? So each regional center and local advisory committee, and that's where we really do recommend that folks engage with that group so that they can start to learn in their area, how can they, their loved ones, and their community benefit from those funding options? And then what does that mean? So a couple of examples. Coaching, self-determination program coaching is something that a lot of folks are funding. And that is, again, that's something that happens after the evaluation. Or, I'm sorry, after, I just read the chat as that came up, sorry. After the orientation, and while folks are in that journey of getting to, they're not enrolled yet. That is where we noticed in the surveys and in the evaluation, people were having the biggest struggles. And that is obviously a place where that orientation implementation funding is going. So that looks differently, but it gives people that extra warm connection to help check in and make sure folks are kind of on track, on target, and understanding where they are in the process and know maybe when to draw on that additional support. So that's one major way that the state kind of has allotted those funds to address those very needs that came up during that evaluation.
Great. That's wonderful to hear that we're really getting our boots on the ground, hearing from the voices of the community, and really trying to implement these things in a way that's going to be most helpful. I believe Dr. Moody did put a link into the chat for those local meetings. So use your voices, everyone in the audience, so that way you can help improve SDP and make it more individualized. I'm also seeing another question here about that standardization. And that's really tough across the board, as you both have mentioned, right? This is in our state, but it also varies region to region and demographic to demographic. And I think I've seen a couple other questions here too on maybe leveraging the service coordinators, but any thoughts on how to incorporate or utilize that role of the service coordinators to improve SDP, or how that's being included into this conversation?
Yeah, I know that Christine probably can speak a little bit more to the directives. She's so well versed in the new updates, but that was a major recommendation in trying to increase standardization across the state. We know that, regional centers are all, unique and can have some discretion around, their operation. However, for example, some of the specific recommendations around standardization we made were, having a standardized enrollment process with standardized deadlines, after 60 days, this has to have happened. After, 4 months, this has to have happened, to really create some accountability and clarity around what's expected and what is kind of required in order to move people through the process in a timely fashion, since we really heard from many people about extremely long delays, over a year, in trying to get enrolled in the self-determination program. I also know that, the standardization around the types of services or goods that can be purchased, and I think there was a directive that helped to clarify that, because there was some discrepancies across regional centers that we were hearing from families and from the independent facilitators around, for this client, this was approved, but for this other client, it wasn't, and that is so frustrating and not equitable. So really thinking about clarity on those levels is across the state is very, very important. I don't know, Christine, if you have anything to add related to standardization.
Well, I think we have about a minute left. So standardization is a hot topic. And so I certainly can't offer a whole lot of insights in less than 60 seconds on that. But what I would say is knowing that the program in its current form is still pretty new, right? And while we are all learning, I think that there are some discussions, and again, I'm speaking from the state council. I can't speak from any other entity, but I know that there have been some discussions about ensuring that service coordinators are well-versed in self-determination. We know that service coordinators have large caseloads, and if they're working with someone who isn't maybe on a dedicated self-determination team at their regional center, that they're learning together. They may know the basics, but until you get to really work with someone from sort of start to enrollment and then beyond, really both parts of the system are learning together. And I think that that's what we really emphasize in the orientations, is really increasing and building that communication, that transparency of communication between you, the service coordinator, and anyone else that you're pulling in, and to make sure that it's as fluid and open as possible, knowing that there's learning and growth happening on both parts of the system during this process, right? As it gets refined. And I think just reminding folks of that is really important, because we know that it's frustrating. We know that it can feel really overwhelming. But knowing that we're all learning together as things unfold and improve is, I think, a key as you're trying to navigate.
Right. That those bumps in the road are actually very informative and important to address, because if it's happening to one person, it's probably happening to many. And those are opportunities for streamlining, standardization, and improving SDP overall. All right, well, I'm noticing time. A big round of applause again to our wonderful speakers, Dr. Christine Moody and Christine Tolbert. Thank you both again for such a wonderful and informative talk. To our audience, the recording for today's lecture, the slides, and a list of excellent resources from Christine Tolbert will also be available on our website in just a couple weeks. You'll be sent an email when those are available. Please do send us a message if you have any questions. And then we look forward to seeing everyone again next month for our June Distinguished Lecture Series. Thank you both again for being here. It's such a pleasure having you.
Thank you.
Bye, everyone. Take care.
Bye.
Bye.